Research shows that sleep apnea affects more than 30 million people in the United States. That is almost 12% of the total population. Generally speaking, more men than women are thought to have this serious condition. Before we talk about the seriousness of this sleep disorder, you must be wondering, what is this condition? I haven't heard of it before. We get it. That's why we bring you this video. Today we will be discussing what sleep apnea is, what causes this condition, and what are its 5 major symptoms, how it is treated, and should you be worried about it. Find out all of this and much more in this video as we unfold the details of this sleep disorder. So, let's get started. Seriousness of sleep apnea. Talking of sleep apnea seriousness, according to various studies, obstructive sleep apnea is linked with a huge risk of health conditions that affect your heart and blood circulation. Now you must be wondering, what does that mean? Basically, the thing is that an increased risk of coronary heart disease will result in increased risk of heart failure, abnormal heartbeats, strokes, and high blood pressure. Sleep apnea is also associated with depression. This sleep disorder can also make you more prone to facing fatal accidents during working hours or even when driving on the road. In fact, it's estimated that people falling asleep while driving due to sleep apnea were responsible for almost 130,000 car collisions. So as we can clearly see, this is an extremely serious health condition. So what is sleep apnea? Sleep apnea. Sleep apnea is a condition that is caused due to interruption in a person's breathing during sleep. It may cause you to snore loudly and feel tired even after sleeping for the whole night. Individuals with untreated sleep apnea can't breathe continuously during their sleep. Not only that, but it can also lead to different fatal diseases. Other than motor vehicle accidents, untreated sleep apnea is responsible for job impairment and underachievement in school in children and teenagers as well. Though the potentially serious condition is common, it usually is not diagnosed. Typically, people are unaware that they are experiencing its symptoms because they mostly occur during their sleep. In short, these sufferers tend to go undiagnosed and hence don't get treated. Types of sleep apnea. Now let's look at the major types of sleep apnea that govern our world. In general, there are 2 types of sleep apnea: obstructive sleep apnea and central sleep apnea. Obstructive sleep apnea is the more common one. It occurs as continuous episodes of partial or full blockage of the upper airway when asleep. It is an apneic episode. The sufferer's chest muscles and diaphragm work much harder as the pressure rises to open the blocked airway. As the breathing resumes and its rhythm tries to go back to normal, a body jerk or loud gasp is heard. These episodes usually interfere with normal sleep and in the longer run cause heart rhythm irregularities. Why? Because they decrease the oxygen flow to the vital body parts. The second type of sleep apnea is central sleep apnea, which isn't very common. It is mainly associated with the function of the central nervous system. In this type of apnea, the respiratory control center is the main component that causes the episode. The center becomes unstable, which stops your brain from signaling the muscles to breathe. This means that you don't make any effort to breathe for some time. You might face a hard time staying asleep or getting to sleep. You might also awaken with shortness of breath. There is another recently discovered form of sleep apnea called complex sleep apnea syndrome, which is a combination of 2 types that we have just discussed. Currently, more research is being conducted on it, and doctors don't yet have much information about it. Causes of sleep apnea. So what causes sleep apnea? This health condition takes place when the muscles in the back of your throat relax. These muscles support your tongue, the soft palate, the side walls of your throat, your tonsils, and the triangular piece of tissue hanging from the soft palate, the uvula. As you breathe in, the airway closes or narrows upon the relaxation of the muscles. You are unable to get the required air, which ultimately reduces your oxygen level in the blood. Your inability to breathe immediately alarms the brain. Your brain rouses you from your deep sleep for a short period to let you reopen your airways. People don't remember this awakening because it is too brief. Some sufferers might gasp, snort, or choke, which is common. This typical pattern can repeat itself up to 20 times or more per hour, all night long, not allowing you to sleep restfully and deeply. Moving on, let's dig deep into the symptoms of sleep apnea. Common symptoms of sleep apnea. Typically, the bed partner of the patient recognizes the first signs of sleep apnea. As the sufferer is unable to identify the symptoms, they have no sleep complaints. The 5 major symptoms of sleep apnea are loud snoring, cognitive impairment such as irritability, trouble concentrating, or forgetfulness, daytime fatigue or sleepiness, gasping or choking feeling upon awakening, restlessness during sleep, sore throat or dry mouth upon awakening. Other signs and symptoms of this sleep disorder are mood disturbances including depression or anxiety, excessive nighttime urination, night sweats, sexual dysfunction, regular nighttime awakenings, headaches. Individuals suffering from central sleep apnea commonly experience insomnia or recurrent awakenings. They also report sudden awakenings with a feeling of choking or gasping. People with central sleep apnea more often report recurrent awakenings or insomnia, although they may also experience a choking or gasping sensation upon awakening. Children may not show obvious symptoms, but may include the following: poor school performance, behavioral and learning disorders such as attention deficits, hyperactivity, sleepiness or sluggishness, difficulty in swallowing and daytime mouth breathing, inward movement of the rib cage when inhaling, intense sweating at night, weird sleeping positions including sleeping with the neck hyperextended or on the knees and hands. Diagnosis of sleep apnea. Your doctor may diagnose sleep apnea in different possible ways, such as medical history. Your medical history is a smart way to determine sleep apnea. Your doctor will go through symptoms and signs depending on the provided information. Physical exam. You may also give a physical exam to your doctor. It will help in identifying signs of various conditions that can increase the risk for sleep apnea. They may also look at the position of your tongue and your jaw size, structure, and size. In addition to that, the doctor will check your neurological systems, lungs, and heart to diagnose common issues associated with sleep apnea. Sleep studies. You may be referred to a center or sleep specialist for a sleep study. These tests can also be conducted at home to examine oxygen levels in the blood during sleep, find high or low levels of activity in your muscles that control breathing, find events during sleep that are associated with sleep apnea. Watch your brain and heart activity while you rest. Your doctor can diagnose you with the condition of sleep apnea according to the number of sleep apnea events you had in an hour of the sleep test. 5 to 14 apnea events in an hour refer to mild sleep apnea. A moderate case has 15 to 29 apnea events per hour. Those with the severe case have more than 30 sleep apnea events. There is also a possibility that your doctor takes several other tests to determine numerous medical conditions that may lead to sleep apnea. To rule it out, your doctor will order blood tests to check your hormone levels. Treatment of sleep apnea. Once you are diagnosed with sleep apnea, you will be treated according to the seriousness of your condition. If your condition is mild, your doctor will advise you to make some lifestyle changes, only such as quitting smoking, losing weight, etc. If your case is severe, your doctor may recommend other treatment options such as oral appliances. Your doctor may recommend you wear an oral appliance that will keep your throat open. Oral appliances are quite effective and easier to use. Your doctor will also find you the appliance that's most suitable for you. Continuous positive airway pressure machine. Continuous positive airway pressure machine, or in short, CPAP machine, is designed to create air pressure greater than that of the surrounding air pressure. The machine passes this air pressure through a CPAP mask while the patient is asleep. In this way, the machine helps to keep your upper airway passages open to prevent snoring and stop sleep apnea. You may talk to your doctor if the mask is uncomfortable, or if you are unable to sleep while the machine is functional. If the CPAP machine doesn't do the job for you, there are other air pressure devices that you can try. There is a machine called Auto CPAP machine that is designed to adjust the pressure while you sleep. Another machine called BiPAP or BPAP machine exists that applies bi-level positive airway pressure. This machine is made to give your body less pressure during exhaling and more pressure upon inhaling. To summarize, when a person has sleep apnea, their breathing repeatedly stops and starts during sleep. Symptoms include daytime sleepiness, loud snoring, and restless sleep. Untreated sleep apnea may lead to complications such as critical heart disease, stress, and depression. It can also leave a person feeling drowsy, increasing the risk of accidents while driving or working. Patients commonly suffer from 2 types of sleep apnea: obstructive sleep apnea, OSA, and central sleep apnea, CSA. Out of these 2 forms, the first type is the most common one. Doctors may use various methods to diagnose it. Its 5 major symptoms are loud snoring, cognitive impairment, daytime fatigue, choking feeling upon awakening, and restlessness during sleep. There are treatments for this sleep disorder that varies depending on the severity of the patient's condition. We hope that you benefited from this video. If you did, please hit the like button and share this video with your friends and family. What do you think about this video? Do let us know in the comments below. Want to see more videos like this one? Please subscribe to our channel, Welcome to Wellness, and press that bell icon as well so you never miss another video. We'll see you in another healthy video. Until then, it's goodbye from my side.